Good morning and happy Monday. I hope everyone had a joyous and safe weekend. Today is day 8 of 20, the electronic health record. So, first thing we're going to go over are announcements. Remember to make sure that you complete all of your assignments. Your daily assignments are due by 11:55 p.m. and your labs are due by Sunday. So in your assignments, there were little technical difficulties. The labs that say they're due on Monday, those labs are due on Sunday. It's not allowing me to change it back to Sunday. Remember, all labs are due on Sunday night by 11:55 p.m. Again, make sure that you're looking in your grade section of e-learning for your PowerPoint slides. I sent an email in reference to informing you all that your PowerPoint slides for the electronic health record is in your grade section of e-learning labeled PowerPoints. Remember, your Zoom classes are in the grade section as well, labeled Zoom link or Zoom class. So remember to always check your news and announcements, read your emails in its entirety, and check your e-learning, the grade sections for updated and upcoming information. So I'm going to go ahead and share my screen with you all. And what we're going to go through, we're going to go to the PowerPoint slides. We're in chapter 3 and 4, privacy, confidentiality, and security. Remember, majority of this information on your PowerPoint slides it's in your chapter, but it also helps. It's a little more clear when you look at your PowerPoint slides to get that pertinent and helpful information. It tells you on here, if you go back, these are the objectives that are being covered in this chapter and in chapter 4 as well. Explore the history and scope of HIPAA, discuss the legal meanings of privacy and confidentiality, list and discuss the types of security safeguards in the medical practice, also access and complete forms related to patient privacy in the electronic health record, which is EHR, become familiar with patients' rights under HIPAA and explore how they affect the EHR, identify organizations aimed at securing EHR systems, discuss access to protected health information, including who has legal access to patients' records and under what circumstances, discuss methods that patients can use to protect their health information. Next is the Health Insurance Portability and Accountability Act, HIPAA. I'm noticing that when I'm having this on the exams, you all are getting this confused. Make sure you know the title, the abbreviation is HIPAA, but what does it stand for? Health Insurance Portability and Accountability Act, HIPAA. Privacy rule, security rule, and portability of insurance. What is privacy? This is one of your daily assignments. Ethics. Ethics is a set of rules and standards of conduct that grow out of a shared understanding of rights and wrong and govern our professional behavior. Laws, formal enforceable rules and policies based on community standards of conduct. Privacy, patient's freedom to determine when, how much, and under what circumstances his or her medical information may disclose. So the patient has the right to inform with this information. So if they don't have your name stated when it says that last will and testament or just to provide information and you're not stated, they will not be allowed to share that information. Confidential versus anonymous. Confidentiality refers to how the recipient of the information handles information that a patient does not wish to share. Anonymity. Information cannot be linked back to the patient. Example, performing lab tests using an ID number instead of a patient name. Anonymous. So they don't want this information shared with anyone. Privacy rule. Establishes privacy standards for use of individually identifiable health information, helps patient control ways their health information is disclosed, requires disclosure of health information to be logged. Disclosure documentation. Patients are permitted to request a log of disclosures of their protected health information, PHI, protected health information. Remember that will be on your final as well, which must include the following for each disclosure: the date of this disclosure, the name and address, if known, of the entity or person who received the PHI, a description of the PHI disclosed, an explanation of the purpose of the disclosure, or a copy of the patient's written authorization, a copy of a written request for a disclosure, if any. Disclosure documentation. Entities providers are required to distribute notice of privacy practice, NPP, notice of privacy practice, designate a privacy officer, provide authorization forms for release of PHI, remember PHI, protected health information, implement privacy to protect PHI, develop procedures for correcting errors in the electronic health record, provide privacy training for staff. In your labs, you will see that they have authorization forms. Review, make sure you're following step-by-step of the privacy authorization forms. So all of this information for your chapters are in your PowerPoint slides. If we go on to your book, chapter 3, it's showing right here everything that we just discussed. Security safeguards in the medical practice. There are 3 types. This was one of your daily assignments as well. What are the 3 security safeguards in the medical practice? Administrative safeguards, physical safeguards, technical safeguards. Patients' rights under HIPAA, access to protected health information. So again, as I explained, please read the information. Your information is in your book. Make sure you know your key terms. This is very important that you know your key terms. It tells you here about the Health Insurance Portability and Accountability Act. This information was in the PowerPoint slide that I just reviewed. Confidentiality versus privacy. The PowerPoint slides just give you a clearer pattern for you to look at. You don't have to read as much, but it's good to know more pertinent information in your chapter. The PowerPoint slides break it down for you. Critical thinking exercise 3.1. This was one of your daily assignment questions. Confidential versus anonymous. Can patients' genetic profiles be used against them? It explains. The privacy rule. And here is an example for the job description for HIPAA security officer. Make sure you all review the job description and what's required. Disclosure authorization. Covered entities and business associates. And it tells you here the covered entities. Review the chart. A healthcare provider, this includes a health plan, a healthcare clearinghouse. So a healthcare provider, this includes providers such as doctors, clinics, hospitals, psychologists, dentists, chiropractors, nursing home pharmacies. A health plan, this includes health insurance companies, health maintenance organizations, which is HMO, company health plans, government programs that pay for health care, such as Medicare, Medicaid, and the military and veterans health care programs. Then you have a healthcare clearinghouse, This includes entities that process non-standard health information they receive from another entity into a standard, example, standard electronic format or data content or vice versa. We review all of this information as well in your NCCT practice, which is every Tuesday for 2 p.m. Remember, please, if you can, join the NCCT practice for your certification exam every Tuesday at 2 p.m. We go over and review this information that will be on your certification exam. And if you're unable to attend, the link is provided for you to review. The covered entity is responsible for establishing a written contract with the business associate that outlines the specific requirements and responsibilities. The contract outlines the privacy and security requirements of PHI. PHI is what? The protected health information. You have your minimum necessary standard, authorization versus consent. Make sure you read that information. And it tells you here when you get ready to go into your lab in the simulation playground, components of an authorization form, complete name, date of birth, and address of the patient. So in your chapters, it's telling you the information that's going to be required when you're in the simulation playground. So if you get any of these incorrect, when it comes time to that quiz, it will be marked wrong. So the components of an authorization form: complete name, date of birth, and address of the patient, a description of the information to be disclosed, including specific dates and for what purpose, a description of the information that may not be disclosed, the name of the individuals providing the information, a list of individuals or entities to whom the information may be disclosed, a date on which the disclosure expires, a statement informing the patient that the authorization may be revoked if he or she changes his or her mind, a notice advising the patient that the information disclosed could be redisclosed and therefore would no longer be protected, the patient's signature and date signed. The HIPAA privacy rule permits but does not require covered entities to voluntarily obtain patient consent for uses and disclosures of PHI for treatment, payment, and operations. Many healthcare facilities have the patient sign a form giving consent for their health information to be used for treatment, billing research purposes, etc. Then you're going to have for your exercise 3.2, authorization for the release of medical records. So this is going to be a summary, but you're going to use that information that they explained, components of an authorization form. So right above it, and then you're going to have complete the following exercise, an EHR exercise found in the info panel. Chase Murray was entered into SimChart for the medical office as a new patient in Chapter 2. So you're going to go back, you're going to review this information, and you're going to fill this out in your simulation playground, exercise 3.2. So remember, I am assigning multiple labs, but you will have time to complete them. Just make sure that they're completed by the end of this module. If you have any questions, concerns, please remember to reach out to me. My office hours are Monday through Thursday, 8 a.m. to 5 p.m., and on Fridays, 8 a.m. to 4 p.m. If you will need information or assistance with your labs or your daily assignment, please call me, text me, or email me so we can set up an additional time to do a one-on-one review. Remember, you have to text, email, or give me a call during my office hours so that we can set a time, if it's after office hours, to do a one-on-one session to review any information you're having concerns with. Again, happy Monday. Enjoy your evening. Bye-bye.